Thank you, everyone, for being here this afternoon as we continue our response and soon-to-be recovery from the coronavirus COVID-19 pandemic. The numbers everybody's been following. Now in the world, around 2.2 million cases of the virus have been reported. 675,000 of those cases in the United States. And it's really scary. In the last week to 10 days, as I've made reports to our citizens about those numbers, that the percentage of cases in the United States continues to grow. Just a week or 10 days ago, our percentage of cases in the world was at 27%. And then a few days later, it was 28%. Now, today, we're at 30.7% of cases worldwide in the United States of America. And so if that trend continues just for another few days or a week, we'll be at a third of all cases in the world in our own country. And that's still alarming to me, and I think to our citizens. In the state of South Carolina, a month ago, we just had our first case, and now we're over 4,000 cases in the state of South Carolina, and 385. And so today, even though I do want to talk with you about the city's plan for a measured and strategic reopening and recovery from this corona crisis that we've been in, I must say it's still time to stay home, to stay distant, to flatten that curve that we've been talking about for the last few weeks. So we all know the challenge. This disease came upon the world, and there's no known cure or vaccine. It's contagious as all get out. Wherever folks are around it, they seem to catch the disease. It's very contagious, and particularly for the elderly and those with underlying health conditions, it can be fatal. So that's why it's such a challenge and such a crisis. So the three-step plan that the city of Charleston is engaged with is to shut down or stop the spread. That's the part of the plan that we're still in, y'all. We're still in the red light zone of being careful, staying at home, try to contain the contagion and the spread of this disease. The next step, and I'll explain some conditions and actions that come with it, is a strategic reopening to prevent future outbreaks, but to get our economy going once again. And the third step, which will come down the road a little bit, when a vaccine or really medicines that can ably treat this disease are in place, to have a full restoration and improvement of our economy. So first, the conditions that will need to be required for us to move to this strategic reopening. First, we must see evidence that the rate of infection in our community is low. Secondly, there must be a robust public health infrastructure with strong testing and contact tracing capabilities in place. And thirdly, there must be sufficient medical infrastructure and personnel and equipment to handle any surge that would occur with the disease. Now, the good news, really good news, is that we are close to meeting two of those three conditions. The first one I want to talk about is the evidence that the rate of infection in our community is being lowered. And that means we've been flattening the curve. It means we've been successful over the last few weeks with folks staying home and staying distant to contain this contagion. So these charts come from the Medical University of South Carolina. This first one shows the confirmed cases per 1,000 population in the Charleston area. It's actually the Tri-County region. As I mentioned, in Charleston County itself, there are now 385 cases reported. For the Tri-County region, it's around 500. So the numbers have been growing, right? But importantly, our percentage is only 0.68 cases per 1,000 population. And if you compare Charleston at 0.68 to other cities and places in the world, particularly those that have become hotspots, you'll see a big difference. New York's rate is 10.9, almost 11 cases per 1,000 of population. New Orleans, 9.5. Lombardy region of Italy is 5.5. China, where the disease first began, Wuhan, China, at 4.5. Seattle and Albany, Georgia are examples of right about 1.5. So Charleston, South Carolina, being less than 1 per 1,000, we've relatively kept the contagion down to relatively low numbers. We deserve a huge pat on the back, Charleston and our community, for doing that. And so, what does that do in terms of the rate of growth? You see some spikes on this chart, again provided by the University of South Carolina, that shows early on in our first days of staying at home that there were spikes as a percentage of testing done that really showed some ability for big increases here. But over time, as this community listened and cooperated and stayed at home and distanced, the curve was lowered. We flattened the curve. It's, again, a remarkable thing that this community has done, and I'm very thankful for that. So that's one of the conditions that must be met, that the rate of contagion is quite low. Now, President Trump asked that this be the case for 14 days before we go into a reopening, strategic reopening. And we are well on that way in that one condition. Now, the second condition I want to mention is sufficient medical infrastructure. And you may have seen earlier this week that Medical University, in fact, reported that they believe they can handle, along with our other healthcare providers, the number of cases that DHEC and that MUSC now projects to occur in our region. So again, on the second condition, we're in pretty good shape. Now, the third condition needs some work, and that's a robust public health infrastructure for testing and for contact tracing. And thanks again to MUSC and yes to DHEC. Tests are on the way. They've been ordered. I talked to Dr. Cawley today at MUSC, and literally hundreds of thousands of these tests that we'll need for this stage of recovery are on the way and should be available in our community in the near future. So I really see us very soon being able to go from the red light to the yellow light and begin our strategic reopening. But what happens when we get to that point? We must take some actions, and those are mentioned on this diagram on the far right. You're right. First is what I just mentioned, is the widespread testing and robust contact tracing. In case someone tests positive, you still got to have the ability to run down where they've been, do the investigation, and figure out how to keep the disease from having another spike or spreading again. We want to prevent the spread to those who are most vulnerable in our community. And so we need special eye and protection of nursing homes, senior citizen centers, and for those individuals that have underlying health conditions. So just as an example, in the city of Charleston, we have 1,800 employees. We're asking those employees with those underlying health conditions to self-identify themselves so that we can keep them safe. Reopen most businesses and public spaces with continued social distancing and limits on crowd size and a particular emphasis on hygiene and sanitizing surfaces and all like that. So even, folks, when we reopen, it's going to be a continuation of distancing, having masks available, washing your hands, all those good practices that the CDC has given us. And to form a regional group, a task force, if you will, of business and healthcare leaders and community leaders to help guide as we move forward. And I've begun that effort yesterday. We have an amazing organization called the Charleston Regional Development Alliance. They were formed after the economic calamity that we had years ago when the Navy base closed, and they are willing to step up to the plate and partner with the chamber and the healthcare providers and really put the infrastructure in place and the protocols for our businesses to reopen. So it's not an easy matter of just flipping the switch on and everything's back to normal. This is going to be a new day and a new world for a while until there's a effective treatment and or vaccine for this disease. And then truly we get to the third step of fully restoring our economy with a focus on diversity and a focus on making our economy even stronger than it was when all this began. So the bottom line is for this weekend, for right now, we're still in the red zone, folks, and we need to stay the course. We need to stick with it a little bit longer to continue to flatten this curve and to keep the numbers down so we meet the requirements as outlined by the CDC and President Trump, that we have 14 days of the numbers going down and decreasing so that we can begin our strategic reopening and recovery. But in the meantime, as you can see, we're planning for it and getting all the pieces of the puzzle in place so we'll be able to do just that. So without further ado, I would like to call on Chief Reynolds and make a few comments about just that, keeping these measures in place for the short term so that we continue to keep those numbers down. Chief?
Thank you, Mayor. As everybody's aware, the governor has opened up some of the restrictions and the expectations on boating, in particular the boat landings and the boat ramps. And so those starting today at noon and through this weekend will be open. What he has continued and consistently emphasized, which is what the mayor talked about just now, is we have to continue to do that responsibly. That means that the boats must stay underway. That means that the boats cannot be tied together and with large groups gathering. There should not be more than 3 or more people on a boat other than family members. And those boats can't even be anchored unless they're fishing, and there's exceptions for commercial fishing. As the mayor said, we have a little bit further to go. We support the governor in this region in terms of opening the boat ramps, but we want to do it responsibly. So as a police department, we're working closely with the Sheriff's Department, the county, working closely with all of our regional partners, with SLED and Mount Pleasant and North Charleston. Both police, fire, Coast Guard, and other entities will be out on the waterways as we have been throughout this event, especially throughout this weekend. It's going to be good weather. There's going to be a lot of people, I envision, on the waterways enjoying their boats, but we want to make sure that people do it responsibly. So it's important to continue to emphasize the message of social distancing. Our community has been fantastic. By and large, everybody has adhered to the majority of these things. And we appreciate that, and we appreciate this great community and how everybody has come together. And as the mayor just described, it's shown in some of the outcomes and some of the results. So we continue to educate, we continue to talk about awareness, and we talk about responsibility and compliance and being selfless and having discipline. So we appreciate our communities doing that. We will be a presence to make sure that everybody does it safely and effectively.
Thank you, Chief. I did mean to share kind of the foundations of this plan that we've worked so hard together. I tell you, the City of Charleston staff and our other community department partners have really all contributed to this. And of course, we've taken the lead from medical professionals throughout, being the CDC, Center for Disease Control, our state's Department of Health and Environmental Control, DHEC, and notably our local Medical University of South Carolina. So we've been listening to that professional and scientific advice all throughout this crisis. Protecting the healthcare system is really a critical issue of all this. You didn't want to have these numbers get to where they overwhelmed our health care system. That was a foundation of our actions. Being flexible so that we're able to take the lead from the federal and the state government, but add to it our own personal local touch as was appropriate for Charleston. Being transparent, and thank you to the media for helping us keep that transparency alive by sharing this information with the public. And lastly, our deep concern for the economic impacts of all of this on our local economy. As has been noted, just in the last month, we've lost over 25,000 jobs in the Charleston area in the hospitality region alone. And that's why it's so important to get to step to the strategic reopening so we can get businesses that are closed now back in operation and back going again, but safely, smartly, strategically, so that we do not see the numbers jump off the chart when we do that reopening. So those were just kind of the fundamental parameters upon we built our actions and our plans. I wanted to share that with you as well. So if anybody has any questions, I'd be happy to entertain them. Yes, sir. Yes, ma'am.
Will the city wait on McMaster's guidance for reopening, or will the city make that own decision?
The question was whether we'd wait for the state guidance on reopening. The answer is absolutely yes. Yes, ma'am, we will. Anybody else?
Have you seen, yeah, this one's for Chief Reynolds. Have you seen a spike in crime?
A spike in crime, Chief. Has there been a spike in crime?
So since this started, we're now finishing up our 5th week. Our call volume continues to be lower and less than normal. It kind of has ticked up, but it's still less than what we normally have. Some crimes are actually down. I'll just give an example: burglary, residential burglaries. Everybody's at home, whereas normally they're at work. So we have actually seen decreases in some areas. We've been paying close attention to suicides and overdoses and other types of crimes like domestic violence, and we really don't see a discernible increase. One area that we have seen some increases is aggravated assaults. And we have had some shootings, and we've had some increases, and we've made some very good arrests. And it's something that I will talk more about, that there's some people who've been released from jail into our communities that we need to be careful and pay close attention to. So that's the one area that we have seen some increases.
So I also have another little announcement I'd like to make, and I'm reminded because Councilmember Shade is here, and he has so wonderfully served, volunteered as one of the co-chairs of the Charleston 350 committee, along with the wonderful artist, local artist Jonathan Green. So admittedly, we were planning a big party this weekend, and we're having to postpone it until later in the year, until all this passes. But for y'all that didn't know, tomorrow, April 18th, is Charleston's 350th birthday. Happy birthday, Charleston. So we'll have a virtual announcement at noon tomorrow, and we've asked the churches to all ring their bells, so there won't be a big gathering at Charlestown Landing like we had originally planned. But I did want to share with everyone that it's Charleston's birthday weekend, quite a milestone, 350 years since the first settlers came to Charleston. If you look at our city's website, and there's a separate website on Charleston 350, you can learn a lot about Charleston's history over those 300 years. And there have been many challenges along the way, haven't there? There's been the terrible institution of slavery, there's been hurricanes, there's been earthquakes, and now there's pandemics. And early in the colony's life, there were pandemics back then when medical knowledge was way less than it is today. So this is yet another challenge that we as Charlestonians will get through together. We're doing it now by staying a little shut down and staying at home and keeping the spread of this virus down, and we're going to reopen and we're going to recover like we never have before, sticking together. But I wanted to share that with you, that it is our birthday, 350 years, and maybe in a little quiet status right now because of the pandemic, but still Charleston strong and going strong. Any other questions? Well, thank you all for being with us, and hope you have a great weekend. It's a beautiful day out again in Charleston. Just do everything responsibly and help us keep the spread of the disease down. God bless.